Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Caffeine is a drug, perhaps the most popular drug in the world, even though many of us don't think of it that way. Maybe you prefer coffee or soda, tea, energy drinks, chocolate, or all of the above. But how does caffeine impact your heart, your gut, your sleep, and how much is too much? And can you overdose on caffeine? We are asking those questions and much more to this panel of experts next to me. Dr. Stephen Thornton is a medical toxicologist and the medical director of the Poison Control Center here at the University of Kansas Health System. He's right across from me. Next to him is our GI expert, Dr. John Ashcraft, a colon and rectal surgeon. And covering the heart for us this morning is cardiologist Dr. Travis Love.
Good morning.
Good morning. So glad to have you all here. This is kind of the definition of multidisciplinary when we talk about how one thing can affect all sorts of places in our bodies. So Dr. Thornton, let's start with you. That we said caffeine is a drug. What kind of drug is it, and what does it do to our body?
So I think it is important to remember that it is a drug. That does get lost sometimes when you see it in so many products and all over the place now on the internet and whatnot. And it is a stimulant, ultimately. How it works is kind of complex, but it basically works inside the cell to kind of get things revved up. And I think anybody who's used caffeine knows the stimulating effect. It increases alertness, can raise your blood pressure a little bit, your heart rate a little bit. And you mentioned, as a drug, you always have to remember that the dose makes the poison. Mm-hmm. And so when we talk about what a healthy dose of caffeine is, I think it's important to remember that we're talking about a dose where it doesn't seem to cause problems, not necessarily that it improves your life expectancy or something like that. So when it comes to caffeine, I always try to tell people that you can live without caffeine. It is not a necessary part of life. Is there a dose that doesn't seem to cause problems? It does seem to be a dose. The FDA comes out about around 400 milligrams a day.
And that's roughly about, what, 4 to 5 cups of coffee?
Depending on the strength, that's one thing that's hard sometimes, because coffee can be 100, 200, sometimes 300 milligrams of caffeine per cup. So it's hard for the layperson to know how much caffeine.
Well, that's what I was going to ask you: is what do you make of this 400 milligrams? The average person isn't. I mean, I know when I stumble to the coffee pot, I load it up, I drink until I can drink no more, and then I move on with my day. Very few people are actually thinking of a number in their head.
Absolutely, and that's what makes it challenging, especially when we start seeing cases where now you can buy caffeine in bulk and just get kilos of caffeine. It's very easy to overdose, and yes, you can overdose on caffeine. Actually, it can be quite scary and life-threatening. We've had individuals die from overdosing on caffeine. It causes seizures and neurological problems that you cannot really control, and so it is like any other drug. The dose does make the poison. It's fortunate that we usually are exposed to levels that don't seem to cause problems, that help a lot of us kind of get through the day, so to speak, but too much is too much. That's what I tell people.
So how does someone know they need to seek medical attention? How would they even know that it was caffeine related?
Well, so the first sign or symptom they'd have, it would be a lot of nausea and vomiting. And then unfortunately they can get seizures, and their heart rate can go really high, their blood pressure can drop. Sometimes they may not even know. The cases we've seen, unfortunately, have been adolescents who had what we call anhydrous, or the bulk caffeine, and they simply were taking spoonfuls of it and rapidly overdose, because you can go from 100 milligrams to 10,000 milligrams fairly quickly.
Okay, we're going to talk more about the kid factor here in just a moment. Dr. Ashcraft, from a GI perspective, when is too much caffeine too much caffeine?
I think everything in moderation. I mean, I think that's the key with all of this, is that caffeine in and of itself is not bad. It's not the worst thing in the world, but everything we do in moderation. Much like Dr. Thornton said, when you have too much of the caffeine in your system or too much coffee in your system, you're going to start getting GI side effects. You'll get some diarrhea, some nausea, some vomiting, a lot of GERD symptoms, especially if you do it late at night before you go to bed. Your GERD symptoms are going to shoot through the roof.
So let's talk personally about you. You gave up caffeine, not just coffee, caffeine a couple of years ago. Tell us why.
I just didn't see the benefit of it. And there are benefits. We're talking about caffeine as mostly from a too much standpoint, but we have to also accept there are benefits to caffeine. But in my instance, I stopped soda, and with that was a lot of caffeine, and then when I was drinking coffee, I just went to decaf.
Well, Dr. Thornton, like you said, it's certainly not something necessary to live. Caffeine. What's your caffeine intake, if you don't mind? I ask.
I'm a tea guy, so it's a little less than I'd say most of the coffee guys. But yeah, it's probably a couple 100 milligrams a day. And like Dr. Ashcraft said, yeah, we're not here to demonize caffeine because it is probably the most widely used drug in the world. But I think it's just important to keep in mind it is a drug. There's good and bad, and there's positive and negatives with it.
Well, and we all have it in our life in some way or another. Dr. Love, what's it doing to our heart?
Yeah, so the effects on the heart you'll see in magazines or coming across your feed on the internet, all these different claims about it's good for your heart or it's bad for your heart. And I think the truth is we don't really have enough data to say one way or the other. Every time a study comes out, months later another study comes out that says the opposite. And so I would say right now, just like Dr. Ashcraft said, everything in moderation. If you feel like it's affecting you, if you feel like you're getting palpitations or increased heart rates, or if you notice your blood pressure's going up, then maybe try cutting back a little bit and seeing if that helps. And just trying to moderate your intake.
So caffeine recently made headlines, and for the wrong reason. You may have seen these wrongful death lawsuits against Panera Bread. These were in the news. This restaurant chain is selling what's called charged lemonade with caffeine levels on par with coffee. But Panera also has a membership where you can get free drinks and refills. According to these lawsuits, 2 people with the membership who also had underlying heart issues, they drank a lot of that caffeinated lemonade. Later, they had heart attacks and died. Dr. Love, we should point out, of course, you're not involved in these court cases,
Sure.
but as a cardiologist, you mentioned what it's doing to our heart, but what type of symptoms might somebody who already has maybe an underlying heart issue come across when they get too much caffeine in their system?
Yeah, so I guess what I'd first say about this is you got to remember that coronary artery disease and heart attacks is the #1 cause of death. So I mean, if you have enough people drinking these drinks or doing these things, people are going to die of heart attacks. It's part of, it's just the most likely way to die in the United States or even in the world. So it's tough to pick apart causation and correlation and what happened here. As far as having myocardial infarction or heart attack from caffeine, I think that data is pretty rocky, and I wouldn't say that there truly is evidence that can cause a heart attack. You can have things like increased rhythm problems, I guess I would say, even though the most common rhythm problem people know about is atrial fibrillation, and that is also a little rocky. But you can have extra heartbeats from the top and bottom chambers of your heart. But yeah, it's tough to really link something like that directly to caffeine.
To caffeine. There would definitely have to be an underlying problem, most likely happening.
Yeah, even then I think it still may be hard to truly show it without some sort of overdose like Dr. Thornton had talked about.
All right, let's give caffeine a little love this morning. So what might some of the benefits be from caffeine? I'll let anybody jump in on that.
So I'll jump in first, if that's okay. There are benefits to it. It sharpens the mind. It's been shown to improve memory. It's been shown to increase our energy levels in the morning, so we kind of get up and go. There's a downside to that, and some people crash pretty hard associated with it, but it does have good side effects to it and good uses for it. One to remember is in the neonatology unit, we use it all the time for apnea, prematurity. Caffeine's a regular medicine given to those little tiny babies so that they will breathe. So.
Really? Interesting, interesting. And what about this long-term effect of coffee? They'll say, that, again, studies, they can be foggy at times, but when we talk about long-term effects, okay, people who drink coffee regularly have, live longer or have better outcomes or keeps cancer away or, what are your thoughts on these?
The only one I know of, I'll speak specific to the GI, is that when it comes to the liver, it is protective. There were 2 large studies. One was a Swedish study, one was a Hawaiian study that showed that people who drank coffee had lower rates of hepatocellular carcinoma compared to those who didn't. We also see that rates of cirrhosis are lower with patients that drink drink more coffee than those who don't. And so there is a protective benefit in the GI system that we know of. And then there's also patients that you want to avoid keeping it or avoid using it on, and those would be our patients that have something called IBD or inflammatory bowel disease, like our Crohn's and our ulcerative colitis patients. We don't want them using it because it stimulates the GI tract, and they're already having problems with their GI tract and diarrhea, and they'll get fluid losses, and so we don't want that.
And again, with the good comes the need for moderation. Even though it's good for the liver, it may not be good for everything else across the board. Dr. Thornton, caffeine from food and drinks is one thing, but when this comes in a supplement form, this is where your ears perk up, because this is really concerning and something that came out recently in the news, and I want to talk with you about it. Some unusual options out there, including caffeine as a nasal spray, a snortable caffeine powder designed to look like cocaine. Some supplements are actually concentrated caffeine sold in bulk, where then again you're leaving the consumer up to them to decide the dosage. So what are the risks?
So it's a good example of, there's no such thing as a bad drug, just drugs used badly. And caffeine, unfortunately, is kind of now fallen into that category where we've taken it out of coffee, out of tea, out of all these, and now you have this pure product, and now you really do have the opportunity, unfortunately, to overdose, to get potentially very, very sick from it, like we've already talked about. And I think it is my opinion, it's a bad idea. I think we should respect it as a drug, and moderation being the key there. And certainly some of these products where they're trying to basically reproduce the use of cocaine and things of that nature, in my opinion, just sends a wrong message to everybody, including our youth, which I think this is obviously targeted at.
Good opinion. So do you get a lot of calls regarding this into the center?
We had a little burst there for a while when caffeine, this anhydrous or bulk caffeine kind of showed up on Amazon, and people were just buying it and adding it to whatever drinks they may have had, and that unfortunately got kind of into the hands of some teenagers who, again, used it inappropriately. But that's kind of died down a bit, but unfortunately, we're always kind of just waiting at the Poison Center. We're always waiting for the next TikTok challenge or whatever, unfortunately, to occur, and then we'll probably see problems.
And we could go around the table here, because when we talk about kids, I mean, it's everywhere. Now you're saying you can consume it online, the caffeine. My kids are 7 and 10, and they want to go through the Starbucks line, really more for the sugar than the caffeine, I'm sure. But what do you think about this? This used to be kind of something for, I always think my grandparents and my parents would, take down a pot of coffee, and now it's literally everywhere. Drinking coffee is cool for kids. Dr. Ashcraft, you're shaking your head. What do we do about this?
Well, I don't know what we do about it, but it's pervasive. That's what I was agreeing to, because
I need your answers.
I've got two that are just getting into college, and Starbucks is like for one of them is a mainstay for them. He actually works at Starbucks. So, and I also noticed he works out a lot, and we were talking about it earlier. His pre-workout drink that he drinks has 190 milligrams of caffeine in it, and so much like Dr. Thornton said, it's very pervasive in that it's creeping into everywhere.
Do you talk to your kids about it?
I did. When I found out he had it, I was like, do you really need that? Is that really that important to you? And so we've had that conversation, but I have to admit I just recognized it last night. So,
Dr. Thornton?
Well, one thing to also bring up is even though you look at caffeine on the list, there are other ways that companies can sneak caffeine into products using these kind of herbal things and whatnot. So even though your product may say 100 milligrams of caffeine, there may be this guarana or other products in there that actually add that much more caffeine. So we think it's very, very hard to avoid caffeine. It's very hard to, in many ways, to know how much caffeine you're taking. And I do think I try with my children to keep caffeine away as much as I can. I think that's the one area nobody really knows what's the developing brain and caffeine. What is the risk there? We don't know that really. And then, of course, caffeine and sleep is a huge problem.
Right.
And we already have a problem with kids not sleeping enough.
Exactly. And we used to think keep caffeine from kids just because it keeps them hyper, but now it just seems like it's bleeding into all sorts of issues. Dr. Ashcraft was talking about pre-workout with his son. Again, that makes me think of a heart, because your heart is racing when you're working out.
Yeah.
Why do people feel the need to do that? Is it to push through? Are there other options to try to push through to get through a workout? What's your advice or your concerns?
Yeah. So I think it's about trying to find energy to get you through a workout, whether that's early in the morning and getting up and getting going. I mean, taking a pre-workout drink is very easy and simple to do, or late in the afternoon when you're tired and run down from a long day. I think people are trying to find ways to get energy to get through a workout. And again, I think the same story here is moderation, knowing how much caffeine, if it's 190 milligrams of caffeine, and that's all the caffeine you're taking in for the day, I think that that's not an unreasonable amount if it works for you.
Yeah, because we were saying 400 was the amount for the day, so that's not so bad.
So if it works for you and that you feel okay with that, I think that's reasonable. But if you get in there and you're working out and your heart rates are racing, you're feeling lightheaded or dizzy, then maybe you're taking too much, maybe you're not staying hydrated enough. I think a lot of this, just because the science is so murky in some of these areas, you just really have to find out what works for you, how you feel on it, and just always recognize that there is such thing as too much.
Any myths that we can debunk here today regarding caffeine? Like you said, it's not all bad. In fact, you've mentioned, Dr. Ashcraft, several really good areas in which it helps patients. Anything else that we want to make sure people know? The good, the bad, the ugly?
I would start with I would caution people about just, every headline that comes out saying some new thing about caffeine, whether it's decreasing mortality or increasing mortality or whatever risk and benefits. I'd be really cautious about those studies because a lot of them are not very well done. And so that would be my kind of last point on that.
You do what? What's your coffee intake a day? You about 16?
I drink
one cup?
Yep, 1 cup, 16 ounces, and that's good. And honestly, I drink coffee because I like the flavor more than I do actually the caffeine. So I'd probably be fine with decaf. I just don't make it at home.
So how do we cut back? If somebody wants to cut back, where do they start, and what symptoms might they feel as far as withdrawals go? Dr. Thornton, I'll start with you.
So caffeine withdrawal is real. I think probably everybody who's ever used caffeine has felt it at some point. Primarily it's headache and just kind of irritability, and part of the coffee culture is sort of that getting rid of the withdrawal. So it's kind of a rewarding symptom when you drink the coffee in the morning and I feel so much better. So that kind of reinforces the behavior. But definitely headaches, definitely just kind of feeling irritable, down, and so withdrawals is real, happens, and it drives some people to continue to take caffeine maybe when they don't want to. But they got to get rid of the headache, or they got to get rid of those symptoms.
Dr. Ashcraft, what were your withdrawal symptoms?
They much like a headache, fatigue, and they peak at around 48 hours afterwards, but they can last several weeks.
And you pushed through?
Yeah, it's not the worst. A couple of Tylenol, you'll be fine.
Okay, so let's talk about caffeine for clearing out the system. We were talking before the show that a lot of people will drink coffee, the night before you have a heavy meal, the next morning you have your coffee, and you're good to go. So is that a good way to clear out the GI system?
Sure. I mean, it's never been shown to be of harm, that's for sure. Even the patients who have been on caffeine or been on coffee and/or caffeine and stopped it have never shown an adverse effect in terms of constipation or anything associated like that. We do know, like we mentioned earlier, is that what happens is the coffee hits your stomach and releases hormones, and that stimulates the colon to contract, and therefore you'll have a bowel movement. We also have to realize that only happens in about 30% of patients. So 70% don't see that benefit. So the whole poop juice with coffee is not 100% for everybody. We also know it's not 100% related to caffeine. We were talking earlier in that decaf coffee causes the same effects. Not as much and not to the severity, but it does cause it. And so we have to realize that. And so if that works for you as a patient or as a person, every morning I drink my coffee and then I go have my bowel movement, yay for you, keep it up. I'd recommend putting some fiber in there so we can have some fiber, but aside from that, keep it up.
Yeah, you do you. Okay, and you're wearing blue tie today because it's Colorectal Cancer Awareness Month. Just anything you see different when you look at someone's colonoscopy after they've had one, anything you notice between maybe a heavy coffee drinker versus a non-heavy coffee drinker?
No,
Nothing?
not that I've ever
No correlation?
Noticed. Not that I've ever noticed. Stimulant laxatives, if you're on laxatives that are stimulants, we can always see that on a colonoscopy, but not coffee drinking.
Not coffee and caffeine, heavy caffeine. All right, if you have questions, be sure to do that right here on the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Information is right there on your screen. Let's get a check of our COVID count with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning. Happy Monday. You got your coffee kicking over there.
I love the smell of coffee in the morning.
You do.
And
you do love your coffee.
Caffeine is a heck of a drug, so yeah, I'm just,
That's what keeps you going on those rounds.
It does. It does. So, right now the COVID count is a little bit improved from where it has been. Just up a little bit from last week. We have 18 active patients in the hospital and a couple in the ICU. So, holding under 20, which is good, and hopefully we can push that number even further down for active inpatients for COVID.
So, Hawk, on Friday, the CDC officially dropped its isolation guidelines for COVID-19. Now, COVID prevention guidance it's grouped together with other respiratory illnesses like like flu and RSV. That guidance says that if you're sick, you stay isolated until your symptoms are improving, or until after you've been fever-free for 24 hours without using medicine like Tylenol or Advil. So, Hawk, if someone is getting over COVID, they want to be considerate, they do not want to spread the virus, remind us, what do we do?
Yeah, I think it is really interesting. If you go to the CDC and you type in COVID or go to their COVID site, there is a little link that says isolation. Before you could click on that and have all the COVID isolation guidance. Now it is redirecting you to another page, which is this page that we're showing. And this is in general. They wanted to simplify it for all respiratory viruses. So I think it's important what you said, Jessica, is you need at least 24 hours of fever-free without any fever-reducing medications, and also improving symptoms. But the important part here now is also that for the next 5 days, you should be taking precautions to help reduce the spread, because we know COVID can spread. We know, unfortunately, SARS-CoV-2 can spread before symptoms, but even for several days after those symptoms begin. So it is important to understand those other previous pillars of public health that we have talked about, understanding the situation that you're going into. Is it indoors, outdoors? If you can, go into an area where there is as much free-flowing air as possible. Also, good hand hygiene is always vitally important, and try to avoid putting your hands in your eyes, your nose, your mouth. Wearing a mask is always okay. We know it does help prevent you getting infected by these respiratory viruses, even if those around you are not wearing masks as well. So these are the things that you can continue to do to keep yourself protected, and of course, stay up to date with your vaccines. Obviously, we know that the ACIP group and CDC did recommend a second shot, a second dose of the updated COVID vaccine for those adults over 65 if it has been 4 months since your last dose as well. So these are all important things to remember. Hopefully they've become second nature by this time. We still want to protect people. We know that for the most part, the pandemic is over as far as affecting our daily lives, but there are still some groups of people that are significantly affected or can be significantly affected by this disease. So it's very important to have a plan and speak with your physician if you should have symptoms and test positive.
All right, Hawk, thank you so much.
Yeah.
Let's get to some questions from our viewers this morning. And Jeremy wants to know, does caffeine actually increase your energy level, or is it just the alertness that's making you think you have more energy, or is it just kind of all one and the same?
I don't know that you can really tease those two apart. I mean,
Okay.
it definitely will rev things up, but it's in itself not supplying calories, if that's the question. It is basically a stimulant, much like some of the amphetamines and stuff like that. It just basically gets things, your brain more alert. Stimulates some of those neurotransmitters, but it is not giving you energy per se, as in like calories.
Caloric energy. Okay, that makes sense. Joe Ellen wants to know, any correlation between drinking coffee and smoking cigarettes?
Not that I know of.
Well, I can tell you there actually is an interaction there where the smoking will increase the metabolism of caffeine, so that the people who smoke often drink more caffeine, and when they stop smoking, then all of a sudden now the caffeine becomes more, they become more symptomatic to the caffeine, because they're used to being able to metabolize it quickly because of what the tobacco smoke does to some of the enzymes in the liver. So there is actually a little correlation there. And you'll talk to some folks who stop smoking, all of a sudden like, oh yeah, I was drinking a lot more coffee than I used to.
That makes sense.
Because as they smoke, they chew up the caffeine much faster than folks who don't.
Can you be addicted to caffeine?
So that's kind of controversial.
Yep.
It is not an official diagnosis, but we know that you can certainly have withdrawal, you can certainly have caffeine dependence. Addiction, though, takes a step of doing something that is causing you harm, or in spite of harm, and that's, I think, where it becomes very controversial.
What can you add, Dr. Ashcraft?
No, I agree with everything Dr. Thornton said. It's not in the DSM criteria as an addiction, and so that's where the water gets muddy. But yet there is data showing that it releases dopamine in the brain, which leads to it, which is an addictive property of most medicines that people are addicted to. So is it an addiction? It's tough to say, but it's easy to quit. So.
Well, we say that, I'm addicted to coffee, I'm addicted to lots of things, but not truly by the definition of addiction. Question, how do I know how much caffeine is in something? Dr. Thornton, you said that food manufacturers, they sneak stuff in on us. It's not necessarily on the label.
That's true. I mean, I do believe the FDA requires, when they put caffeine as like pure caffeine in something, they have to tell you how much. But when it comes to like coffee and teas and stuff, you really don't know fully.
So can you trust labels?
Well, to the degree that it says it has X amount of caffeine, I would trust. But then when they have these other products in there that also have caffeine that they don't have to list, that's where it gets really murky.
Okay.
Yeah.
Makes sense. Okay, so question, does caffeine, Gene wants to know, does caffeine affect your growth? These are lies. Is this a lie I tell my 7-year-old? Or am I being truthful to him?
Actually, I don't know that there's any data out there
yeah.
to support growth retardation in children. So,
But
I would say
can I
it's a lie.
can I keep telling him that?
You can
though?
tell your child whatever you want.
Yeah, there's no
If it
evidence
keeps
there
them
isn't.
away.
Yeah.
There is some, but much like we talked, I think we mentioned earlier, is there is some conversations and some data out there about the brain growth in children that are using a lot of caffeine and long-term side effects that we don't know.
Right.
This generation that we have right now is going to be a little bit of an experiment for us because, much like with my son, I mean, he's getting his caffeine with his energy drink before his pre-workout, and I see him drink his energy drinks, and I see him, he's at Starbucks, and so I think they're getting a lot more caffeine in their diet than we ever thought.
A lot more exposure. And no, I do not feed my 7-year-old caffeine. But you know, it starts like that. It's like a kid putting a beer up to their parents' beer just to smell it and see what it tastes like on their lips. The same thing with the coffee, you know. So do you have young kids?
I do.
How old are they?
6, 4, and 2.
Okay, so these are future
They're not
coffee
coffee
drinkers.
drinkers yet.
Future
Not
coffee
yet.
drinkers,
Yeah,
like
so-
Dr. Ashcraft's kids. Okay, so question is, can you develop a tolerance for caffeine, which means you need more of it to get the same effect?
Yes, that can definitely. You don't develop a complete tolerance to it, but there's definitely cases where folks need more and more just to kind of get either back to feeling okay or to have any sort of the stimulant type effect.
Okay, as we were talking about kids drinking caffeine and energy drinks, all sorts of caffeine. I mean, not just coffee. We're not giving coffee just a bad name. But is there an age limit or an age in which kids are more safe to start drinking it? I mean, past a growth age, you know, anything that parents should be alerted to?
I would say growth maturity. That would be mine.
Totally.
I would say if they're reached their growth maturity and
Or they're 18 and they can do whatever they want?
yeah, that's where I am.
Darn it.
That's basically when you have to surrender. But yeah,
Yeah.
I think you know the caffeine in the developing brain is something that I'd rather err on the not exposing, if I can, category. And so I would say if you can keep them from caffeine till their least late adolescent, you're doing a good job.
Yeah. Okay, before we get to our takeaways today, just can you reiterate again what you've said, Dr. Thornton, just about, just so parents are aware of these caffeine supplements and this Snortable and this spray that they can find online. I really want to make sure people are hearing that so that they're aware that it's out there.
Yeah, so that's the thing. Like I said, caffeine has been taken out of these products. Now you can buy it in bulk. You can buy pure caffeine, and that does really raise the bar of toxicity, the ability to overdose, and to see these sort of adverse effects and deaths that we just don't think about with, but I don't think anybody drinks a cup of coffee, oh yeah, this caffeine could kill me. Yet we know that if you take too much of just about anything, and caffeine included, you can have fatal consequences.
And it's out there.
It's out there,
It's
yeah.
on the
You can
market.
unfortunately find it in a lot of places, and it's promoted, and that's, like I said, where it's really important, I think, for people to just appreciate that caffeine is a drug. That's a big takeaway.
Yeah. Any other takeaways you want people to go home with today?
I think just remember it's a drug, it's good and it's bad, and everything in moderation, and the dose makes the poison.
All right, Dr. Ashcraft, what's the takeaway?
Much like we said earlier, just try to restrict it as much as possible, but everything in little amounts is okay. The 1 cup of coffee a day with Dr. Love is just fine.
Yeah.
If his heart can take it, our heart can take it.
I like that.
But everything in moderation. But it is pervasive. It's in everything now. I mean, we haven't even mentioned chocolate, and it's all over. It's in every chocolate you
Don't
eat.
go after chocolate. Don't do that to me.
It's in chocolate, sorry. And so it's everywhere. It's pervasive, and you really should try to watch it. So.
Well, let's talk about that. Is chocolate okay for the heart? Because I heard that's like antioxidants and good.
Similar deal with the studies. I don't know what to tell you. It's also very murky, but a little bit of chocolate in moderation is probably not a bad thing.
Not going to hurt me. What's the
Yeah.
other takeaway from a cardiology standpoint when it comes to
I would say
caffeine?
specifically when it comes to the heart is kind of pay attention to how you're feeling and how you're reacting when you're taking in whatever substance, I guess in this case coffee or an energy drink. If you're feeling the effects of it, 30 minutes after you drink an energy drink or coffee and you're feeling like your heart is racing or you're having skipped heartbeats or palpitations, maybe try scaling it down a little bit or limiting it. See if that helps at all. You don't have to stop things. I think moderation is what we've talked about all morning here, but just kind of listening to your body and reacting accordingly.
I like that. Gentlemen, thank you so much. And if you did not get enough of Dr. Ashcraft today, he'll be back with us tomorrow, Colorectal Cancer Awareness Month, and you're going to be talking about some somewhat alarming things that you're seeing when it comes to diagnosis. People
Yes,
much
ma'am.
younger getting diagnosed. So we'll dive into that tomorrow. Gentlemen, appreciate y'all being here today.
Of course, thanks for having us.
Thank you. Thanks to all of our viewers as well. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update, oncologists are calling it an epidemic. People in their 20s and 30s getting colorectal cancer, and no one knows exactly why. I'm Jessica Lovell on the next Morning Medical Update. The first warning signs that tipped off one survivor, plus when it makes sense to request a colonoscopy, Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcast. Now, everywhere podcasts are available.